How does addiction affect learning, and can drugs cause learning disabilities? In this video, you'll hear from Master Level Certified Cognitive Coach Andrea Pitman as she reveals the connection between learning difficulties and substance use. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges that come with substance use, addiction, and mental health conditions. All right, let's get right to it.
First of all, we know that anyone that has a learning difference, learning disability, learning difficulty, whatever name you want to put on it, has a higher risk of substance abuse, especially when it is undiagnosed. And sometimes through no fault of anyone, there can be tons of caring educators, caring parents, but something is missed. A student diagnosis may not be real obvious. It might not get noticed until later on, and now they're already behind in school. In the US, we actually call our education system, from the field of neuroscience perspective, it's a failure model, because we wait till children are failing before we diagnose them with a learning problem, instead of diagnosing proactively and looking and assessing first before it ever becomes a problem. And so we have a lot of times where students have already now become where they're failing in school. They're not being successful, even if they're passing their tests and have passing grades. It might be with great struggle, a lot of frustration, a lot of extra support or help possibly. And so a lot of times now students' self-esteem is dashed. They don't like school. Their motivation has waned. And so they will start looking for that fulfillment through school in other ways, or looking to self-medicate for the stress and anxiety and even depression that can be created by being not successful at your job. You know, I always talk about kids' jobs are to be students. So their full-time job is being a student. And if you're not being very good at your job, any of us would probably not stay in a job where we showed up every day and we're not successful. We certainly would probably be anxious before we went, stressed, looking for diversions, trying to find anything to do, like avoidance, procrastination, all of those things that we see in students. And so it's really important to realize that this makes these students at a much higher risk of addiction and substance abuse. The second thing is that we know that some of the issues that contribute to learning differences or learning difficulties are the same things that contribute to making you at a higher risk for substance abuse. So for example, we know that people who, a certain subtype of ADHD means that you have low dopamine levels, and dopamine makes us feel good. And so we're going to continually, as humans, seek things that raise our dopamine levels. Coffee raises your dopamine levels. And for any of you who are coffee drinkers, you know, you feel a bit of a buzz. We feel a little bit high or elevated when we've had our coffee. And that's in part from the caffeine, but the caffeine triggers the production of dopamine. And so we get a dopamine hit. Getting a like on a Facebook post causes a dopamine hit in the brain, which is why when you post something on any type of social media, you keep usually checking to see if you got likes, and you feel a little bit good and elevated when you do. And so if we know that a child who has ADHD also has lower dopamine levels, substances, drugs and alcohol will raise dopamine levels. And so it can be a way of self-medicating. So that's a second issue, is that in that relationship. The third relationship factor is that once you have engage in substance abuse, unfortunately, these substances do damage to the cognitive skills. And low cognitive skills are what cause learning disabilities. So if you are utilizing substances, you are now doing damage to the brain, and now you're at a greater risk for learning problems. And unfortunately with this, when you stop the substance abuse, you still have that damage that's done. Now it can be corrected, but you have to do some sort of therapeutic intervention to correct the damage that was done. And so you might also have this instance where an adolescent did not have a learning difference before, but now they do. We see this in a lot of our adult clients as well that we work with that are in recovery, where they might have been a good student, but now they're really struggling cognitively and to learn or to return to school or the workplace. Or if you already did have a learning difference and now you have engaged in using, altering your brain function through substance use, and now now that can typically make it worse. So there's a lot of different factors there. And then I will say there's a fourth, and not to make it overly complicated, but the fourth thing is that we do know that traumatic brain injuries, which covers concussions as well, even a minor concussion is a type of traumatic brain injury. We know that those concussions and traumatic brain injuries damage your cognitive function. And we know that people who are engaging in drug or alcohol use are at a higher risk of concussion because you're altered. And so you're more likely to have a car accident, to have a fall, to get in a physical altercation or fight, and have some sort of concussion. And so that also contributes to now damaging the cognitive skills when that applies. And so that can exacerbate or create a learning disability in and of itself too.
If you want to learn more about treatment options for you, your teen, or a young adult, then tell us about your situation on a confidential call using the number linked up in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.